Good afternoon and welcome to today's training, Healthcare Transition for Youth with Disabilities. I am Clara Umbe, the Reproductive Health Program Manager at the Nevada Primary Care Association, also known as the NVPCA. The NVPCA staff provides training and technical assistance advocating for local, state, and federal policy change and creating economies for scale through program management to the Nevada Federally Qualified Health Centers, also known as FQHCs. The FQHCs offer all Nevadans exceptional medical, dental, and behavioral health care services. NVPCA has 3 upcoming trainings. Actually, we have 4 upcoming trainings. The first one is Region 9 NCQA PCMH training, which will take place May 15th through the 18th. We have the Western Clinician Network Clinical Excellence and Leadership Conference from June 25th all the way to the 27th. Building a Compliant Emergency Planning Program, which will take place June 27th, and Social Determinants of Health Roundtable, which will take place July 19th. For additional information regarding our PCA upcoming trainings or to subscribe to our newsletter, please visit us at nvpca.org or scan the QR code listed on this slide. I would like to go over housekeeping items for today's training. Please type your name and organization into the chat box. It is nice to see who in the community is attending this training today. If you are joining the call with others in one room, please put their names into the chat box as well. You can ask questions anytime during the training by typing the question into the chat box or raising your hand and unmuting. During the training, please mute your phone or computer so we do not have any feedback or background noise. Also, please do not put your phone on hold or we will hear your hold music. This training is being hosted by NVPCA and the Nevada Center for Excellence with Disabilities. I want to thank the Nevada Center for Excellence with Disabilities for partnering with PCA to offer this training at no cost and provide CE, CME, and CEUs to the health center staff attending today's training. I will now turn the presentation over to our presenters, Lex Owen and Stacy Alabire, to introduce themselves and the Nevada Center for Excellence with Disabilities.
Well, hello, this is Lex Owen. Welcome to everyone who's joined us today. Thanks so much for being here. We really look forward to this conversation, this ongoing conversation about healthcare transition. And this is an issue that faces all youth, but specifically is an issue for youth with disabilities and with special healthcare needs. And so we'll kind of focus on that subpopulation today. In addition, there's some related subpopulations that we won't address in detail today, but those include youth who are transitioning from the foster care system as well. So just something to keep in mind when we think about this concept of healthcare transition, that it really does extend, outward, and potentially there's some particular considerations that should be made for each of those subpopulations. So, like I said, I'm Lex Owen, one of the co-presenters today, and I'm going to hand it over to my co-facilitator, Stacy Alabire, who's going to take us through kind of our overview for today.
Thank you. Lex, do you have is the slides up?
Can you all see the slides? Okay, I think the slides are up, Stacy.
Okay, let me just, I'll get the slides on my end. Just give me a second.
Sure.
My computer's not.
I think while Stacy's getting set up on her end, I'll also just do, again, extend our welcome once again, and then Thanks to those who have put your information in the chat. It's great to be here with you today. We do want to just say, I talked a little bit about what this is, but just again, kind of defining upfront this idea of healthcare transition, or HCT for short. Here, we're really interested in kind of specifically in the healthcare realm, thinking about how we're moving from a pediatric, a child-centered model of healthcare to that adult-centered care model. So this may entail moving clinicians, and sometimes it doesn't, but there's a lot that goes on with it in terms of, making sure that youth are prepared to kind of own and take charge of their healthcare. And so, really this is about kind of helping, youth build some of those leadership skills so they're able to advocate for themselves and transition to that adult healthcare model. So overall, we're looking at two main goals of healthcare transition, right? How do we know success when we see it? The first is increase young adults' healthcare management. And like I said, this includes both young adults without and with disabilities or special healthcare needs. And then the second goal that we're looking for here, our second kind of measure of success, is that we can kind of have a process, right? And so we're looking both at the individual kind of clinical level, but also thinking about how do we build out these systems that are going to help us do this for all patients, right? In a really equitable way, that everyone is getting kind of the same opportunities to have that adult, that successful healthcare transition. So we really want to think about things like care planning, transfer, and implementation, right? What's actually going on, right? What are we actually talking about when we are saying healthcare transition? So we're going to kind of dive into a few of these levels, right? So Stacy's going to talk about her experience transitioning as a youth with disabilities to new healthcare providers. We're going to talk about GOT transitions, 6 components of healthcare transition, and then we'll also dive into a case at the end. Throughout the time here together, I also want to we'll also be offering up some kind of more concrete tools that are available both on GOT Transition's website and also elsewhere. So there's a few kind of best practices that have emerged. And so I do want to just shout out GOT Transition, which is kind of the national center. They're funded to focus on healthcare transition, and they have quite a bit of resources that are specifically for youth with disabilities. Before we go too further, I want to also acknowledge our funders for the Nevada Center for Excellence in Disabilities Family Navigation Network. We have funding from both the Maternal and Child Health Administration through the Health Resources and Services Administration, as well as we're also funded through our state Division of Public and Behavioral Health, their Title V block grant subaward. So we're really thankful for the way that they sustain us to do this work and have this great partnership with NVPCA and all of you. So I think Stacy, you're good to go, right?
Yeah, I'm good.
Are you able to see the slides?
Yeah, I'm able to see the slides.
Terrific.
Thank you.
Terrific. Okay, I'm gonna keep going, and I'll go over today's learning objectives, and I'll hand it over to Stacy in a little bit to talk more about her experience with healthcare transition. So I did want to highlight our learning objectives for today. We will define the elements of youth healthcare transition from GOT transition. And then we'll also, we'll ask you to analyze how your own practice or clinic could apply these elements. And then we'll also have a case vignette to consider how we could actually envision or, kind of practice using these components in practice. And I'll hand it over so Stacy can introduce herself.
Hi, everyone. Sorry about that technical issues. But I'll introduce myself. I'm Stacy Larry-Bear. I have my MSW from the University of Nevada, and I also hold an LMSW. and I'm glad to be here presenting with you guys today.
Thanks, Stacy. And Stacy, also, I just want to say, you're also a Nevada LEND trainee, right? Which is the, I just want to make sure everyone knows what LEND is. Do you want to say a little bit more about LEND?
So currently Nevada LEND it's a training program for people with all disciplines. There's a social work major. You can be a social worker, nutritionist, a psychologist, and it can be spanning from 14 disciplines. The disciplines I mentioned, the more discipline, but also needs a self-advocate, and I'm representing as a self-advocate as well as a trainee for this year. And also there's parent trainees. The goal of the program is to teach disciplines how to effectively work with individuals with children with disabilities and their family members. So for this year, the application that we're running, there my last, it's ending, Nevada LEND is ending this year and have applications coming for next year. So if anybody's interested in it, well, the application is closed, but it has openings maybe sometime in the next year after. So if anybody's interested.
Yes, thanks, Stacy, for that reminder. Yes, the applications for next year's Nevada LEND program are open. So we'll try to pop that link in the chat at some point during the training today, so y'all can have that if you're interested. And so again, once again, I'm Lex Owen. I co-direct the Family Navigation Network, which is a project of the Nevada Center for Excellence in Disabilities. I'm also an assistant professor in the School of Social Work at University of Nevada, Reno. So I have research and practice experience with people with disabilities and their families across the lifespan. Really interested in kind of thinking about, how do we facilitate family professional partnerships, specifically in the context of healthcare, right? So how do we make sure that we are increasing both access and satisfaction for youth with disabilities and their families related to healthcare? So those are our deals. So yeah, it's great to be with you all here today. Okay, so let's talk about the problem. So why are we talking about this, right? We can all agree, right? When we hear the definition of healthcare transition, we can agree this is a good thing, right? But remarkably, it's not happening that much. So the national statistics from the National Survey of Children's Health demonstrate that only about 30% of youth across the board, and those numbers are slightly lower for youth with disabilities, receive some kind of healthcare transition activities, right? Through that transition. We know this is happening, but we don't know, obviously, what the ins and outs of that look like. And so, this is something that is obviously a hugely prevalent issue, right, for youth, but then we know that it could be happening in a way that prepares youth better for that adult system of care. So even if youth get care at a community health center, they still might move for college or other events. In addition, like I mentioned in a previous slide, this isn't always about moving clinicians, right? But rather it's about increasing that ownership over one's own healthcare, and how do we actually help build in those skills, those processes to make that happen. And we also know, specifically when we think about youth with disabilities, they often have increased healthcare transition related needs. And actually we'll hear more about that from Stacy when she shares her own experience. So on the screen is an image of a stylized image of a cliff. And so the reason this is here is that transitioning in general from pediatric to adult services is often described as a cliff. Youth and families must jump off, right? So we think about there's more kind of support, there's more of a family oriented approach, both in healthcare and in other systems like education. And families experience that usually that transition is experienced in a very negative way, right? And that's certainly this kind of nightmare, the bad outcome that we want to try to avoid. We want to try to do what we can as professionals and providers to help support youth and families during this often tumultuous time. So I'm going to hand it over to Stacy, and she's going to talk a little bit about her experience. And Stacy, just let me know when you'd like me to move the slides forward.
Okay, thank you. So this is my experience. I'm going to be talking about my experience as a person with disability related to healthcare transitions. So growing up as a child and having to be seen to many different providers because of my disabilities was very excruciating for me. Having to transition from one provider to the next was hard. And it was it was me and my parents when my condition was a lot. So it was a lot of transitioning between healthcare providers as a person with disabilities. And between when I'm transitioning from one provider to the next, I would have to explain a lot of things multiple times, which happens with most people with disabilities too. And it could be excruciating, like I explained. So when that happened, it was excruciating, but fast forward, I did find myself a provider, a neurologist who was in California. But then we were communicating for a little while, but then I somehow lost communication with him, and then we stopped. So I had to jump in to get another healthcare provider, which was excruciating because I needed someone that could understand me. And this was another issue, having to explain my condition to other providers, and then the best way to help me out as well as my family members. Can you move it? So, when I lost communication with him, I did end up having to struggle to find new neurologists that would help me, and it was a never-ending story. So I do bring this to your attention because this is what young people and children with disabilities, as well as their family members, have to go through in finding different providers every single time when for a lack of communication, like what happened in my situation, or different situations happening. So I do want to explain that. Can you move the slide? Thank you. So, okay, and this happens not just in healthcare settings, but also my insurance that I have. And because I have to go through many insurances that would be the best fit for me as well as my parents in helping me because I currently receive physical therapy and having a good neurologist. So I need an insurance plan that could help me that's better prepared for me as well as my family members. So let me go back to when I was on my parents' insurance plan, and everything was good because I got my neurologist and I received good physical therapy. But as soon as I got kicked out at age 26 is when you get kicked out of your parents' insurance and you have to transition. So for me, transitioning was hard to find the right health insurance for me. So I spent a lot of time doing that. And eventually when I got the right insurance for me, I was able to continue on getting the help I need. Yeah. So can you move on? Thank you. So I'm gonna talk right now about potential solutions that would be helpful. So the solutions would be to include youth with disability in the process and making sure they're the center of the process. You can't transition without including the youth with disability in the process. They need to emphasize their self-advocacy skills, for talking with providers about the individual's needs, what they need, having their voice heard, and providers actually helping to find new providers to go to. So again, the youth with disabilities need to be in the process, to find, even so the providers can find the providers could find what's beneficial for the youth as well as the family in their healthcare journey. So they need to be in a process. So to be in a process, so it could prevent them from being alone, from youth and people with disabilities from being alone and hung out to dry. So they do need to be in a process when considering transitioning from one healthcare provider to the next. Can you move the slide? And this is my resources, because I know youth with disabilities as well as their families experience, they feel alone, but I want to say that they're not alone, because we're in the fight together, youth with disabilities as well as others with disabilities like myself. And I wanted to address a few resources that helped me along the way and that are held today. So I wanted to, so for one of the resources, you got the God Transition website, and then understanding decision making, like how to include youth with disabilities and people with disabilities in their health care decisions, and increasing for youth with disabilities and other people with disabilities. It's important that they take classes to increase their self-advocacy skills. And that's my slide. Thank you. So, yeah. So I'm done.
Awesome, Stacey, thanks. I wanted to, there was a lot in there, what you said, and I wanted to just highlight and pull out a few of the things that I heard that I think are pretty impactful. You highlighted a few kind of pressure points that were real issues for you and your family. The first was this idea of having to explain what's going on for you, over and over to new providers. The second was, this idea of kind of challenges in communication, like maybe there's some kind of lack of communication in terms of that follow-up, and then also the insurance transition. And so I wanted to also just add here that, for you, Stacey, that happened at 26. For others, they're wanting to transition to Medicaid as soon as possible. And so sometimes that happens at 18. Some folks, it happens at 21 or 22 because of their in the school system a little bit longer. So it can happen at various times. And so I think that's another kind of thing I wanted to highlight from your experience, Stacey, that, as providers and professionals, we don't need to assume, right, what's going on for that person, but instead, as you emphasized, really, helping to develop those self-advocacy skills while not making the person and their family feel kind of left out, right? As you said, hung out to dry. We don't want to, have folks feel like they are on their own, rather to have that kind of support and scaffolding. So yeah, I think that's terrific. And I think also what you've described is a really common experience for a lot of folks. So thinking about kind of this framework of healthcare transition, and again, taking this from Got Transition's website, they are kind of the authority on this topic for sure. But let's, as we think about how do we do this in Nevada, right? To think about how this fits in for our state, there's a few different pathways, right? And so the first pathway I just wanted to highlight is this idea of transitioning youth to an adult healthcare clinician, right? Another way this can look is thinking about transitioning to an adult approach without changing clinicians. And then finally thinking about, how do we, from, an adult clinician perspective, right? How do we kind of make sure that we're able to integrate young adults, emerging adults into the new into that adult practice, right? So there's a few different kind of directions and pathways that this could, in terms of how this could look. The second kind of image on the screen here is, a brief description of the 6 components of Got Transition's healthcare transition. So, in some ways, this is a pathway, right? It's a stepwise process, but we also know that, we might meet a patient who is 23, right? You might meet a patient at 23, and that maybe that transition has not begun, right? And so these ages along the bottom here are a little bit of a suggestion. Maybe that's like an ideal scenario, but we know that things are not always ideal, right? Or that maybe the readiness takes, a little bit longer than, is kind of laid out here, right? And so thinking about this as somewhat of a guideline, but we'll talk about each of these components next. So I also wanted to highlight one of the tools. I talked a little bit about how, there have been a lot of kind of more concrete tools that have been developed. One of these that I wanted to mention is something called the Family Voices Family-Centered Care Assessment Tool. This has been developed by Family Voices, which is a national family leadership organization. And so they are kind of our member organization as the Family Navigation Network. So they've developed this for providers. And so it has a lot of different areas, but one of the things I wanted to highlight is this kind of self-assessment that providers, that practices can take in order to kind of self-evaluate whether and how healthcare transition is happening at your center or in your practice. So some of the questions here, I'll just read them off. The first question is, do you and your staff ask families and children about their vision for the future? For example, kind of taking time to think about hopes and dreams, goals, things like that. Also, are you and your staff connecting families and youth with information and resources to support achieving their vision in ways that respect their cultural beliefs? So thinking about, are we doing this in culturally responsive ways? And then finally, do you and your staff offer opportunities for families and youth to meet with older youth and adults, young adults as role models, right? And so again, thinking just about, because this really speaks to what Stacey was talking about in terms of building those self-advocacy skills and also helping families envision, this can, depending on the patient, depending on the family, this could look a little bit different. And then the second question here, and thinking about, do you and your staff help youth learn about things like, health management, dealing with the logistics of care settings? Maybe the biggest issue is transportation, right? How is that person going to get to their doctor's appointments, right? We know that that's often a barrier to healthcare access. So again, just thinking about offering this tool as a way to kind of help gauge and also just raise awareness and understanding among your health center, among your practice, to think about as you kind of focus then on healthcare transition. So this first element is really thinking about developing a transition policy for the health center or practice, and having that guide. So you'd want to make sure in developing this that you are getting that input from families and from youth. And then also thinking about, it might be actually a good idea to also include adult clinicians, right? So if your health center has all of those things, right, it works out really well. But to think about, what are those, the goals, right? Or the roles that are laid out for each of the, everyone has kind of a job to do, right, in this team approach. And then, is there a way to ensure, for instance, that this policy or this guide is given out to every youth, right, at their visit, or that, there would be some kind of policy, right, initiated in order to make that dissemination happen. And then when we think about the second component is thinking about, okay, so we have our policy, our guide set up. So how do we track and monitor this, right? And so how do we know who's, it's time to kind of help them transition? Are there questions, that could be initiated into that visit? So some folks, and I'll talk about this in a second, have actually introduced additional electronic medical record questions that are built into the system. The two images on the screen here, one is an example, one is a piece of an infographic that could potentially be, posted in clinic rooms, right? And these are both available on Got Transition's website. So the first image on the left says, what is healthcare transition? Thinking about, are you ready to transition to adult healthcare? There's a quiz that is for youth that I'm going to ask you all to take in a minute. But thinking about, the role that a smartphone could play, there's actually pretty positive emerging evidence for interventions that are smartphone based, right? So texting seems to work pretty well for young adults related to healthcare transition needs. So reminders, little tips, right? All those things that tend to work pretty well. And then on the right, there's an additional kind of resource guide for youth, right? And so really, this is an example of what Stacey was talking about as well, in terms of trying to give youth some kind of guidance and support, ideas about what to ask their doctors, right? This is the first time that, youth have done this as well, right? So thinking about, for instance, one of the questions on this sheet is, asking, when do I start to meet with you on my own for part of the visit to become more independent when it comes to my own health and healthcare? So just kind of asking those questions. Another example is, can I work with you to prepare a medical summary for me? And if needed, a plan for what to do in case of emergency, right? So thinking again about one of the things that Stacey brought up was having to repeat the kind of medical information, the background over and over again, versus if she had, a practitioner work with her who was willing to kind of prepare that pre-done summary, right? She would be able to avoid that. And then also thinking about, right, emergency preparedness as well. So then the third step is thinking about transition readiness. And so we've talked a little bit about what this could look like. So there are some transition readiness assessments out there, and one that we'll talk about in a minute. But again, thinking about, how do we identify the areas where youth are needing education, right? This webinar is focused on providers, right? But what do families need to know? Families are in, again, like I said, they're facing down that cliff, right? So how do we give them what they need to know in order to be able to, have a parachute, right, when they jump off that cliff? And then thinking about, maybe there are particular issues that have emerged through that transition readiness. So the question is, like, do we have a plan for when we have that need identified, right? Do we have outside referrals that we can make, providing additional, education and training for youth and families? And so I wanted to highlight, again, this is kind of an emerging area of research. And this has been demonstrated to have pretty good results in terms of, increased implementation. So this was developed at Texas Children's Hospital. They call it the EPIC Transition Planning Tool. The actual tool is only available within Epic. So if you have an Epic account, if you're an Epic provider, you can actually go in and grab the. So their questions include things, just asking the youth, for instance, like, how much do you know about your medical condition? So really starting at a pretty basic level. But what providers found is that by asking those questions, they were able to get a lot of information, right? That then they could use to kind of customize that transition experience, right? And so providers were often surprised by how little the youth knew about their own conditions and their own self-management of that condition, right? And so it was really helpful for providers to understand just what youth were kind of experiencing, right, and what they were comprehending. And so that had a really strong impact, a positive impact. So this is called the Transition Planning Tool. Again, it's been validated in the research, and so I recommend you look into it, because it could potentially be a way, adapted for other settings as well. So an additional approach here is, in terms of kind of getting into that mindset of what youth are experiencing. I invite you all to take Got Transitions healthcare quiz. So you can either use, there's a QR code on the screen, or Brandy, I think, is kindly, yeah, Clara, thank you. Clara put it in the chat, the link. So whichever you would rather do. So go ahead and take a minute. It's not a very long quiz. It's about 6 questions, but answer it as though you were a youth, right? Kind of put yourself in that youth shoes, to be able to, think about how a youth would be going into this process potentially. I'll give you a couple of minutes to do that. All right. This is Lex again. Take a few more seconds if you're still finishing up the quiz. And Karen reminded me just to highlight that Got Transitions materials are also available in Spanish, and I will check on if they're available in other languages as well. But I know that everything on their website is available in both English and Spanish. So thanks, Karen, for that reminder. I'd love to hear what you all thought about taking this quiz. What was it like? You'll note at the end, right, after you complete the quiz, that it will offer kind of customize your kind of level of transition readiness. And it also offers, customized resources, right? And so if you answer questions, based on how you answer questions, it'll offer you different items. I wonder if anyone would like to kind of share what it was like to take this, and if it helped you think differently about healthcare transition. You're welcome to shout it out, or put your in the chat. Karen says, love all the options and the instructions and resources in the summary. Yeah. Hannah says, I need to update my medical ID on my phone. Yep. I was thinking the same thing, Hannah. I was like, oh, I guess adults probably need this a little bit too. Monique says, I love the resources at the end. When I aged out of my parents' insurance, I had no idea what to do. So something like this would have been super helpful. Yeah, Clara says, me too, Hannah. Yeah. Right. So we can see how this is a pretty, like you could put this, and use the smartphone, right? Use the QR code, or, even you could print it out in your, during the visit, when, a youth is waiting for, the nurse or the provider to come in. Eileen says, love taking the quiz. It was written simply for young people to absorb. Did not know there was content at the end to help them move forward. Yeah. So yeah, exactly. So it's written in a way that, is pretty accessible for folks, using pretty, plain language. And it's also something that could be easily adapted, right? You could think about, if you wanted to make a version of this that only used images or only used pictures for folks who don't read, that could work pretty well too. It could be really easily adapted. So potentially a decent resource available that you could pretty easily incorporate into that kind of pathway there, that clinical pathway. Rena says, thanks for the exercise. It gave me the opportunity to understand the challenges they're facing and all the concerns that may arise. Right. Yeah, I think that's a great point, Rena, right? Putting ourselves in the shoes of youth, right? And even the way the questions are phrased, I think they're, phrased pretty well in terms of, saying, oh, I know something about this, but I'm not quite sure about the details. And so that's a great place to, Monique says, yes, definitely want to use my clients. Great. Thank you. Yeah. Great. I hope that's helpful. And again, like I said, what I'm trying to do here a little bit is kind of pull out some of the things on Got Transition's website, because there is a ton there. But it's like you could spend and it says, I think this should be part of the health class curriculum in high school. Yeah, I agree. I think that's a great idea. You could spend a lot of time on the Got Transition website. So we don't all have that time, right? So yes. Cool. Okay. So going on to this next step, right? And so again, we're approaching these as these, kind of concrete areas, but we know that there's some overlap too, right? So thinking about, when we actually get to the point where we're in the planning phase and what that could look like. And again, that's going to look different for everyone, but to think about updating a care plan, again, thinking about how do we do this holistically, right? Not in just it may be about a referral to an adult provider. It may be about, making sure teaching the youth about kind of best practices related to medication management. But I think more holistically, right, we want to focus on what Stacy talked to us about, right, which is kind of holistically, how do we make sure that we are preparing youth to own their own healthcare, right? And this includes things like decision making, right? And so Stacy also mentioned supported decision making, which is an alternative to guardianship. Nevada is one of the few states that actually has a supported decision making law on the books, which is really cool. And you can actually there's a website that I will try to find the link for, and I'll put that in the chat. But to really think about how are we supporting youth and their families in a really kind of expansive way, right? And to help prepare them for what's ahead. And then also thinking about, how does this transfer of care actually look like, right? And we talked about how this might be, geographically different, might be different practices, but it may not. So thinking about kind of pulling all of these things together, doing some follow-up, doing some care coordination with the youth and their family members to, ensure that that appointment did get made, right? If it's with a new provider, thinking about, is there a way that that there can be some kind of contact between providers, right, among providers, in order to facilitate that ongoing transition of care that is really patient-centered, right? Thinking about how do we incorporate those components of a medical home. And then the last one, right, just thinking about, kind of, again, providing that, kind of wraparound approach to service, and thinking about, confirming attendance, getting some feedback on that transition process. So maybe, it's the care coordinator or someone else kind of calling to follow up and see, was there anything we could have done differently, things like that, right? But again, I don't want it to be onerous, right? You all have a lot on your plate already, right? But to think about how can we build in these small kind of quality improvement practices in order to, make it more seamless, right? To have better outcomes for patients, and also to make it simpler and more straightforward for providers. So let's look at this case together. And I also want to invite questions, more generally on what we talked about, or even your own experience. Maybe you have experiences as a provider or as a family member or as a person with a disability with healthcare transition, and to think about, you know, what can you offer us, right? We're kind of we're in a knowledge sharing space, right? That's really what we're on about here. But I also want to introduce this case, and so I'll read it out loud for everyone. It's pretty, you know, straightforward, but thinking about, you know, thinking about those 6 components that we've talked about here, what are the kinds of things that could be initiated, that could be done in order to support Tatiana. So I'll read this loud. So Tatiana is a 17-year-old girl who was diagnosed with a rare metabolic disorder at birth. She's been under the care of a pediatric endocrinologist since then, and has been managing her condition with dietary restrictions, medication, and regular checkups. She also sees you, her primary care provider, at the local health center. Tatiana has expressed a desire to have increased involvement in her healthcare. In addition, she plans to move out of state to attend college. As Tatiana's provider, what steps could you take to facilitate her transition to adult healthcare? So thinking about what we've talked about in terms of kind of, you know, both the things that Stacy mentioned, and as well as gut transitions components, I'm wondering what you all would do in this situation. How would you support Tatiana? And again, feel free to put your contributions in the chat, or go ahead and shout them out. I'll give you a couple minutes to think about it. This is Lex. Monique said, did you say she was in foster care? I didn't, but that might be a really important consideration, right? To think about, you know, what her experience with aging out of foster care. So that would be definitely something that you'd want to determine, because that might, you know, make her transition planning look a little bit different. But in this, let's say for the moment that she's not in foster care, but I'm glad you raised that, Monique. Thanks. Katie says, as a primary care provider, I would want to consult with her endocrinologist about who they would want the patient to see in the adult specialty. Some adult specialists are less familiar with pediatric conditions. Yeah, that's right, Katie. That's great. Yeah, so to definitely think about how you'd consult with that specialist, right? And also, you know, in certain parts of the state, there's less access to specialists, right? And so that would also be something to consider in terms of that potential referral to a different state. Eileen says, learn if her health insurance plan will cover her in another state, assist her in finding a specialist in medical home, provide her with resources from gut transition. So yeah, example of how to place that medical ID on the smartphone. Yeah, thanks, Eileen, that's great. Christine says what insurance she has and assist with finding a provider and network that's close to her college. Yeah. So let's say, for instance, for the sake of this case study, that she does have Medicaid. And so some of the work, right, would be supporting her in applying for Medicaid in her new state, right? And thinking about how she'd be able to do that. Something else that is unrelated to this case, but I was thinking about it earlier when Stacy was talking about her experience. We worked with a family that she was 17 and she was trying to establish care with a new provider, with a new specialist. She was still on a diagnostic odyssey. I was thinking about it with Tatiana, because potentially there might be new things coming up for Tatiana as well. So she may also need to see a geneticist, right, on an ongoing way. But the case of this family, the pediatric provider, this patient was 17, the pediatric provider was unwilling to see her, was not willing to allow her to make an appointment, because she was going to be 18 soon. So they were anticipating her aging out, and they said, we don't even want, you know, it's not appropriate for you to establish care here. You'll need to go to an adult, in this case, it was a neurologist. So yeah, it's another complication of kind of the systems. And, you know, in that case, the outcome was that it just caused the family a lot more time, right, to have to search for for a different provider. In this case, the issue was also that they needed a provider who was proficient in Spanish, as the mother only spoke Spanish. So even though they are entitled to in healthcare interpretation, it was a real challenge to get that kind of figured out and support them through that. So that's just kind of another example of how it can go down, right? And the issues that can be caused by a lack of healthcare transition. Monique says, I would meet with her and her parent to find services, both through insurance and through the clinician. I find it helpful to work with the family if they're just part of their children's lives instead of just the client alone. Yeah, that's right. And so really thinking about this as a family issue, it probably does impact the whole family on some level, and thinking about, how are we, ensuring family-centered care as well. Yeah. Hannah says, if Tatiana is okay with it, maybe ask if her parents can help her transition so she has a support system. Right. So yeah, exactly. Hannah, you're echoing Monique's idea, right? To think about, how can we really strengthen that team, right? And make sure that everyone, and that goes back to one of the components, right? Where that's part of that transition policy and guide, is to think about what are the different roles that the youth, the parents, the provider, care coordinator, anyone else who's involved, right, in that kind of clinical ecosystem, right? How and what their jobs and roles will be in that arena. It's a great point. So just something to consider, to think about. Again, there's a lot of different ways that healthcare transition can play out, but having starting with that on the kind of practice or health center level, right? Starting with this idea of having a policy in place that anticipates and kind of allows for, diversity in terms of identity, but also just in the way of, how those healthcare pathways might work, can be, a really strong start. And then also, I do recommend you check out the resources that are available on GOT Transition. But you can also reach out to us if you have specific questions on, how and where to find those transition or those resources. The other thing I wanted to just mention is that GOT Transition also has a list of ICD-10 codes, so the billing codes for different kinds of transition, which I think is also helpful for providers. So they've really tried to, tailor those resources to be as helpful for clinicians and parents and youth as possible. So I think they've done a really nice job with that. Any other comments on this case, or questions or comments on what we've talked about today? All right. Well, I want to thank you for the great conversation today. It's great to be here with you all. Stacey, I don't know if you wanted to say anything else to kind of close us out, but
I was just saying thank you for allowing me to talk about my own experiences and to get you guys' attention and to talk about how to help people with disabilities, and especially young adults and children, along with their parents, and helping them how to transition from one healthcare provider to the next, and how to get the ball rolling on that. So thank you again.
Yes. Thank you. Thank you, everyone. If we don't have any questions, thank you for attending today's training. You will receive a survey on this training, and we would appreciate it if you could complete the survey and provide feedback. If you have any further questions, please contact me, Clara Umbe, at CUMBE at NVPCA.org. So that's CUMBE at NVPCA.org. On behalf of the Nevada Primary Care Association, thank you for joining us and have a great rest of your day. Thank you, everyone.